you would think I would know by now. My name is Megan, and I'm going to go ahead and get started. Ian, feel free to jump in. I think I have met a lot of you, but I can go ahead and introduce myself quick, and then Ian, if you want to go after me, then we'll go through some slides and we can tell you a little bit about our task force. I co-chair the Colorectal Cancer Task Force with Ian Kahn. I work at the Colorado Department of Public Health and Environment as a cancer health system specialist. So I do a lot of clinical quality improvement around cancer screening rates with federally qualified health systems. And I also am the colorectal cancer program manager for some funding that we get from the CDC. And I joined the task force 2 years ago and have been chairing, I think, for just a little bit over a year, co-chairing.
And I'm Ian Kahn, other co-chair. I also work at CDPHE in the Diabetes and Cardiovascular Disease Unit. I started working with the task force when I worked at the American Cancer Society. And I've just stuck with it because I like the work. And it's a really good task force. We've got some great folks on it. So I've been doing it for about 3 years now. So yeah, should we get into it?
Yeah.
All right. Oh, there we go. So
the task force is really, I would say, a mighty work, group, and we have numerous smaller work groups that drive a lot of our changes within our communities, where all of our task force members live, and we focus on different interventions, on how we're potentially addressing not only screening, prevention, and early detection, but also treatment and access and education regarding colorectal cancer task force. So it's very peer-to-peer focused. There's lots of engagement opportunities, and it's really a huge collective action between all of our members to support these different initiatives.
And I'll add one thing. It doesn't live with the task force technically anymore, but policy advocacy has been a big focus of this task force. Got a little bit of help from the USPSTF recently about screening guidelines, which is what the policy work was focusing on, but that work has kind of elevated to the coalition level under Chrissy's leadership. All right.
We have had lots of successes and a lot of projects, different initiatives that we've been working on. A few of our highlights over the last year is we have a very robust colorectal cancer screening awareness work group. So the work groups are smaller teams, core teams that operate under the task force, and there's usually multiple members, and you can be on multiple different work groups, but it's more about this core team that it's ultimately driving a lot of the work. And then we do a lot of report outs at our task force level. So we lit Denver Blue, and we have been holding or planning to hold educational webinars about colorectal cancer awareness. March is Colorectal Cancer Awareness Month. So a lot of our initiatives and education is during that month, but we also want to be educating people throughout the whole year about colorectal cancer screenings. We also have collaborate with a lot of community partners like the CCA and their Undy Run that they hold every year, and Fight CRC. We have a lot of international partners or national partners that sit on not only our task force, but are also actively working within our work groups to address the plan that we have decided that we need to meet in terms of cancer screening. We also have a robust employer support for cancer screening program where we have developed some employer work groups and with videos regarding how cancer screening can be integrated within different employers and supporting their employees.
Yeah, and I would add that, you know, the members drive all of this work. These work groups are led by, not by us. Well, the employer one is led by us, because that was a funded project, from the Cancer Coalition. So thanks to the Cancer Coalition for that funding. So that's being led by me and Meg, but the others are being led by the members of the task force voluntarily. And speaking to the membership, it's pretty broad. We have industry partners, with exact science representation and Pfizer, for example. We have navigators, nurses, doctors. Well, we have a couple of interested doctors, and we're always looking for more clinical folks to join, as well as nonprofit like ACS, of course, and public health folks. So it really is a broad kind of coalition of people driving the work of the task force.
So we have 3 different goals and priorities, and these are ultimately meant to support the work that's in our statewide cancer plan. And the first one is around engaging with employers, focusing on our mini grant and providing education to their employees regarding CRC screening and improving policy and standard operating procedures regarding time off. Our second goal is regarding public awareness and educational webinars and task force presentations. We had a very robust media campaign planned for March in 2020, but COVID definitely steered that in a different direction this year. But we have a lot of resources, not only from the national level, but at the state level, regarding education for colorectal cancer screening. And our third goal is about improving provider knowledge and support for colorectal cancer screening guidelines. This is going to be particularly important within this next year, especially with the potentially updated USPSTF screening recommendations to start screening at 45.
And if it wasn't clear, each of the 3 work groups is executing one of these 3 goals. Great.
We meet on the second Thursday of the month from 7:30 to 8:30. A lot of these meetings have guest speakers or presentations regarding clinical trials or early age onset colorectal cancer. But we also do all of our report outs from our work groups to the task force community as a whole, and how the work is going, and are any barriers or challenges, but also what partnerships do other members of the task force have that potentially could make connections to support the work group initiatives. And then our smaller work groups meet periodically, about once a month, and those times are sometimes ad hoc, but the cancer screening awareness group meets the first Tuesday of the month. And I think the provider support work group, I believe, meets on the last week of the month. I think that's it. Ian, do you have anything else to add?
No, well, kind of. Just a little bit of kind of context around our task force, specifically. This might be too much detail, but there is like specific funding for programming around cervical and breast cancer screenings in Colorado, and there is not the same dedicated funding for colorectal cancer screening in Colorado. And so this task force carries out a lot of the work that would otherwise be funded if it were breast or cervical, or maybe in another state even. And so it kind of operates in the same space. If you were able to join the lung task force, that there's not anything around that supports that screening. And so they are that support. They are pushing for it. And so that's one of the roles that I see this task force playing.
Yeah, I'll just pipe in. The Colorectal Cancer Task Force has been probably one of the strongest task forces through the coalition's history. So thank you for continuing on the leadership, Ian and Meg, and keeping this work moving along, and always looking at evidence-based strategies and focusing on that awareness and education piece. Thank you both.
I know there's some people on here that are part of the task force, and there are, I'm guessing, folks on here that are not. And I would love to just be curious to hear more from those of you, maybe what you are interested in learning more about, or maybe what might excite you about the task force if you're not involved. Kind of curious what brought you here.
There's also a good question in the chat that maybe Chris can answer. Who funds breast or cervical?
Breast cancer and cervical cancer receive state funding through the A35 tobacco tax. They also receive federal funding. Colorectal, the difference between breast cancer and cervical cancer funding and colorectal cancer funding is colorectal only receives federal funding. We do not have a state match for our program. And that just means we also have, I think, more broad limitations on what we can pay for colorectal cancer funding.
Casey noted that she used to be a colorectal navigator here, and not having funding that we had in the beginning was so heartbreaking. Continues to be a challenge.
Yep, we hear you, and we're trying to figure out what conversations need to happen and what we can do, especially, you know, with this uncertain budget time period. Who knows what we can do, but we do have that policy work group that Ian was mentioning. So if anybody is interested in joining in on some of these policy and advocacy conversations around colorectal cancer, let me know, and I can get you put on our email list to start coming to those work group meetings.
Hi, this is Peggy. And one of the reasons I'm a member of the task force is because I don't live in Denver. And I think it's nice for everyone to know what resources Denver has and what the rest of the state is doing, because I'm Colorado Springs, and I think we've done a lot to also promote and have some of the same limitations, but it's a great way to share best practices.
Thank you for highlighting that. You know, when did we introduce Zoom? Maybe a year and a half, 2 years ago, we got all the task forces access to Zoom so that we could ensure that everybody could have that more of a statewide presence. So thank you for highlighting that.
Any other questions or ideas that the task force could take on? I don't want to throw more work at them, but be interested to hear if other folks have ideas of initiatives that the task force could take on.
Or maybe rather collaborations.
I think Chris mentioned an important piece. I think the nice thing also about, and Peggy had touched on this also, the nice thing about our coalition and our membership is we have members from the American Cancer Society that are involved in our task force, and the university, and Andy Dwyer in the cancer screening program. And we've had presentations from physicians with the Ute Mountain Ute Tribe and thinking about strategies across Colorado for our rural partners. So not only are we thinking about best practices, but leveraging those partnerships that also work in very broad and rural areas of the state, and how we can leverage that to increase colorectal cancer screening and evidence-based intervention.
And Paula, I see your question in the chat. I'm not qualified to answer that question. I don't know if we have someone on here that can, but we can always get back to you. So which types of screenings are being promoted? The best test is the one that gets done. So I'll let Ian and Meg fill in, but that's generally a line we'll throw out there.
Yeah, so there's numerous different tests that are supported. Obviously, a lot of my work with federally qualified health systems, we do not want costs to be a barrier, so we often do FIT and FOBT screening for average risk individuals that do not are not asymptomatic. But we are also thinking about how we can utilize partnerships for colonoscopies for those that FIT and FOBT stool-based testing or Cologuard is not recommended for. So it really kind of depends, but I think to Christy's point, we want to make sure that we are offering a broad spectrum of tests and our patients are making an informed decision regarding which test is best for them with their healthcare team, in hopes of, making sure that they're completing that and have buy-in on the decision that they're utilizing for screening.
Christine and Megan, I just wanted to say that I've been kind of an inactive member of the Colorectal Task Force for quite some time. As a longtime volunteer at the CU Cancer Center, I still have my I Love My Butt t-shirt that we used many years ago in promoting the CRC Awareness Day. I'm not sure if any folks are even aware of that t-shirt, but that was quite a politically incorrect time, but it sure got everybody's attention. But I have great experience with some colon issues, non-cancerous, fortunately, but still one of them almost took my life. So I'm a strong supporter of the CRC Task Force.
Tommy, I think you should go find the shirt and show it to us.
Well, it was a little bit embarrassing because I was the only male promoting that particular day, and I told I forgot her name, but I told her that I said, I love your butt too. We only wore them that one year.
Any other questions? Anybody else who's on the task force want to talk about your experience with it and why you stay engaged with the task force?
This is Christina. Can you hear me okay?
Yep.
Great. So if you don't know me, my name's Christina. I'm with the American Cancer Society, and I've been involved on this task force for a little bit, even when I was in my previous fundraising role, just because of my personal connection to colorectal cancer. And I think this has already been shared, but I think for me, one of the benefits is just being able to share best practices and get a better understanding of what's happening throughout the state around colorectal cancer. that's something that I get out of probably the most for the task force, just meeting new people. And, you know, that's a huge focus for ACS. So making sure that we're not duplicating efforts, and if there's opportunities to collaborate and work together. And so I've really enjoyed being a part of this task group because of that. And yeah, I just think everyone's super engaged and it's just a fun group. So I really enjoyed it. But I would say the biggest part is just being able to share what's happening and finding ways to align our work and to do it better. So.
Great, thank you for sharing. Anybody else have anything to share or a question? So Becky, should we just go to a break then and come back for 2 o'clock for the skin?
Yep, that sounds good. I mean, folks you're welcome to hang out here. Looks like there's another question from Paula. Is there a focus on behavioral?
Yeah, behavioral health or behavioral patterns, or
are you meaning like oh, go ahead.
Are you meaning risk reduction in terms of tobacco, alcohol consumption, diet, nutrition, and activity?
in terms of any known described predisposing factors?
Yeah.
Or genetic.
So I'm going to answer this. Yeah, I mean, one of the big components, especially regarding colorectal cancer screening, is Lynch syndrome, and how family history and genetic counseling are incorporated to determining the best test is something that we have worked on and are continuing to work on, especially with our partnership at the university. Those have some barriers in terms of adaption, not only for uninsured, but the underinsured population and how we're utilizing that. But family history and first degree relatives, those all impact cancer screening start dates and even determining the screening tests that should be used. So that's a big piece that's often included in a lot of our education for colorectal cancer screening and awareness, that is becoming more prominent as kind of the literature suggests other genetic factors that could increase an individual's risk for colorectal cancer screening. We don't have any specific strategies regarding like primary risk reduction, like obesity, but those are definitely a big piece of our educational materials and components of our awareness.
Okay. Thank you.
Great. Well, thank you for joining for this meet and greet. We'll have skin cancer up next, but for now we'll have a 5-minute break so you can stretch your legs. And we'll start.
Hey, sorry to interrupt. Did we talk about what to do if they want to get involved? Or did I completely miss that?
You probably missed. We did not talk about it.
Okay.
Here, I'll go back. You can email us at colorectal@coloradocancercoalition.org, and we will respond to you there. You can also join or request to join our listserv through our task force webpage from the coalition website. Thank you, Allie.
Yeah, sorry, I didn't know if I just like blacked out for a second and missed it, or if you
Nope. We blew right past it.
Okay.